afternoon, folks. I'm kind of anticipating someone at some point to ask why I'm always wearing this hat, and it's a fairly straightforward reason for it. Years ago, I developed a kind of a habit of something to signal to me that the workday was over, I was heading home, it was time to leave work, at work, and move on with the rest of my day. I have 4 kids at home, and of course my wife, and I found that probably during COVID, I was carrying work home with me a lot, and just read somewhere like, hey, you need to have, there needs to be some sort of signal to yourself that, hey, work day's over. You need to, leave the heavy stuff at work, or whatever's undone at work that you can't do at home anyway. Leave it there. It'll be there in the morning. That kind of thing. And the hat on at the end of the day is one of those things for me. Okay, I was an athlete, all through my childhood and early adult years and so on. And so hats are just kind of a natural part of that territory. And so this is a Braves hat. Big Braves fan, big '90s Braves fan for sure. Big baseball fan in general. So that's why I'm always wearing my hat, because I do a lot of these videos, at the end of the day when I'm leaving work. And so, speaking of work, I wanted to get on and in one of my shorts not too long ago, I mentioned that I was going to share a patient story. That was just another reason that you need to advocate for your loved ones or advocate for yourself, and if you find yourself in the hospital. So this gentleman, he was in his late 70s, living at home by himself, and had an accident at home and fell, broke his hip. Comes to the hospital where I work and gets assessed in the emergency room. They find out that he has the hip fracture, and they consult orthopedics to see whether or not they're going to do surgery. And they say, well, we want to do surgery. He needs surgery in order to regain his function. However, we're not sure he's going to pass his cardiac clearance based on some other things that he had going on. And so that was where they left it. Okay, so that was on a Tuesday. The orthopedic consultation happened on Wednesday, and they said, hey, he needs surgery in order to regain his function. However, we're not sure he can tolerate it. He needs to get cardiac clearance to be able to see if he'll be able to tolerate going through surgery. So that was on a Wednesday. So Thursday rolls around, they consult rehab services, because they're saying, hey, right now he's not going to need surgery, or not that he don't need it, but he can't go through it. So we're going to have to try to mobilize him as best we can to see what his capacity will be and what kind of assistance he's going to need, and so on and so forth. So we try to start working with him, and it doesn't go well. He can't tolerate moving around very well at all, because he has a significant hip fracture. Okay. Well, the therapist, we were working with him on the Friday, and while we were working with him, the cardiologist comes in and says, hey, I reviewed your EKG, we looked at the echo of your heart, and so on and so forth. It's fine, you're doing well. You're clear from a cardiac standpoint to have surgery. All right, so that's on a Friday. The weekend comes, and we have orthopedic coverage on the weekend, so no one tells or communicates with the orthopedic surgeon that this man has had cardiac clearance. Now, I'm gonna be honest, it's gonna be hard for me to tell the rest of the story without sounding like I'm just being disparaging, but I'm a little bit frustrated, because one of the biggest complaints I find that families have in the hospital all of the time is, we don't know what's happening. It doesn't seem like the physicians, the surgeon or the hospitalist or the kidney doctor or the urologist or whoever, we don't feel like they're communicating very well with one another, and we don't know what's going on. So a lot of times what I find myself doing as a rehab professional in the hospital is trying to play the liaison between the hospitalists and the specialists to try to inform the family on, hey, this is what they're saying, this is what the plan is. And you may be thinking like, well, that's not your job, and you're right, it isn't. But it's also not against the law. It's not against my Practice Act to inform patients about their care plan that's already been established, just not communicated. So all I do to them is read off the progress notes to the person, you know, that their physicians have written. Okay, so what that translates into for this gentleman is that you have the orthopedic surgeon and the cardiologist that need to communicate with one another. You would think that the cardiologist would have seen, hey, you know, this person's waiting on cardiac clearance. Let me notify the orthopedic surgeon that this person in fact has cardiac clearance, and so they can undergo the surgery. That did not happen. And it didn't happen until about a week after the cardiologist had cleared the person for surgery. So, gentleman came in on a Tuesday, orthopedic consults on a Wednesday. He needs surgery, can't have it because we need him to have cardiac clearance. Okay, Thursday rolls around, Friday rolls around, cardiologist comes to visit him, says, you have cardiac clearance, and then nothing else happens until the following Friday. That is unnecessary, and that is not ideal. As a result, this patient could not mobilize very effectively because he has a, unstable hip fracture that's causing him extreme amounts of pain to move around. We tried to mobilize this gentleman, thinking that, he may not have to have surgery, and he just couldn't tolerate it. So we tried to reach out to the nurses and say, hey, somebody needs to communicate with the orthopedic surgeon and let them know, and so on and so forth. And long story short, he finally got his surgery about a week and a half, maybe a week after he should have gotten it. And so what happened as a result of that, he did not move around. He developed a blockage in his small intestine, that's called an ileus, and it complicated his recovery even further. That gentleman stayed in the hospital for about 2.5 to 3 weeks because of the inefficient communication across practitioners. Okay, it was only because, and here's what makes it worse: the hospitalist, the attending physician that was responsible for, when this gentleman was going to be ready to discharge, was ready to send him home without the surgery. To most people with some sort of common sense, when I, recount the story to them, they say, well, how's he going to function at home? Exactly. That's exactly the point. The point is he wouldn't. He would go home and be unable to function at home, and therefore be in great danger of decompensation because he wasn't able to take care of himself or mobilize very well. So the daughter of the patient, at our encouragement, and other people's, therapy service is not going to take all the credit for this, but we definitely encouraged her to say, refuse your discharge because he can't take care of himself. And so she did, and what that did was alert a lot of people to the fact that, hey, this is a problem. And lo and behold, it got escalated, and finally the gentleman had the orthopedic surgeon come back and say, okay, well, I guess we can go ahead and do our surgery because he has cardiac clearance. He had his surgery, and he got on, we were able to work with him more at that point, and he was able to tolerate more therapy, and he finally got out to go to rehab. Okay, so that's just a kind of a convoluted story to show you and to highlight again the importance of being willing to stand in the gap for your loved one. Okay, and not to be afraid to question or bring physicians to task on the things that are well within their purview to deal with. Okay, so thankfully, there was very little complication after the gentleman finally got his surgery, and we got recovered, or he got recovered and enough to go to rehab. So just a patient story, guys, to highlight the importance of ask hard questions. Okay, the healthcare landscape is riddled with inefficiency. There's big pushes to get patients out of the hospital, big pushes to increase throughput in and out of the hospital, so that they can clear beds and get more people in, and so on and so forth. And the interesting thing to me is that all of the practitioners and the providers, we all took what they call the Hippocratic Oath, which means that we should do no harm. We have to have the patient's best in mind all of the time, no matter what it costs the facility. Okay, that's how providers have to operate. So keep that in your back pocket. Be willing to ask the hard questions, and stand in the gap for your loved one when they can't stand up for themselves. And remember, you can't go wrong getting strong. This is Jeremy with the Hospital PT.